So Mike, I don't know his last name, I heard overdosed.
For Cindy Cresswell, the figures are personal.
How many body bags really?
Today, that heartbroken question was answered. 80. Multnomah County officials said 80 homeless people died on local streets, in shelters, hospitals, and so on over the course of 2016. That number is down slightly from 2015, which had a total of 88. But officials don't highlight that. They say one is too many.
We're still having more than a death a week, mostly on our streets. This is too many, they're too young, and they're too preventable.
63 of those 80 deaths were men, 17 were women. The youngest were in their 20s, the oldest in their 70s. 40% of homeless people who died in 2016 died on the streets. A little more than 20% died in hospitals, RVs, hotels, or shelters. And when it comes to how they died, officials say half of the 80 deaths were caused, at least in part, by drugs or alcohol. Half of those by opioids or heroin. We asked today about the role of addiction.
If you're suffering from a mental health issue, from a substance abuse issue, how are you going to get into treatment if you don't even have a home? If you have an underlying disease, heart disease or lung disease.
Finally, officials pointed to weather. Last winter, at least 4 homeless people died. Now they say it may have been more. They add they wouldn't be surprised if cold snaps this month have already claimed at least one life.
We need to believe that people care for us, and then they'll start doing better.
It was tough to talk to her. So this report also dives into geography. It's why we're standing here tonight. Most homeless people in the Portland area who died in 2016 died either downtown or on the inner east side. And by the way, if you want to read that report for yourself, we have posted the entire thing at kgw.com. Chris, back to you.